Hello, my name is Dr. Jonathan Hada, and I'm a bariatric surgeon and the medical director of the Surgical Weight Loss Program at Frye Regional Medical Center. On behalf of our entire surgical weight loss team, I'd like to welcome you to our education seminar for bariatric surgery. Many people are uncertain or intimidated by the thought of weight loss surgery, but we understand that this is a long, complicated, and sometimes difficult journey. But the more you learn about the surgical weight loss process and about our program, we believe you will gain comfort and confidence that this is an important step for your health. In this presentation, we hope to answer many of the questions that you as a patient may have about weight loss surgery. At Frye, we've been performing weight loss surgery since 2001, and over that time we've helped thousands of patients with success stories and dramatically changed their lives and their health. We have a multidisciplinary team of experts to guide and care for you throughout your journey, including surgeons, nurse practitioners, nurses both at the clinic and the hospital, bariatric dietitians and psychologists, and insurance specialists and care coordinators. We're very proud to be accredited as a Bariatric Surgery Center of Excellence by the American College of Surgeons, the American Society for Metabolic and Bariatric Surgery, and most major insurance companies. These accreditations demonstrate excellence in patient care, program development, and surgical outcomes over many years. One of the advantages of undergoing a surgical weight loss procedure at Frye Regional Medical Center is that we work very hard to maintain a personal and warm feel to our program. This includes giving close individual attention to each patient and their specific medical situation. We have a staff that's easily accessible to patients and their families, both before and after surgery. We get to know all of our patients very well during the period leading up to surgery, and we offer a comprehensive, lifelong program of medical follow-up, support, and encouragement after surgery. Before we discuss the surgical treatment of obesity, I think it's important to understand the disease that we and our patients are fighting. The disease of obesity affects millions of Americans each year. As a serious disease, there are many factors causing a patient to develop obesity over their lifetime. There are genetic factors, things we inherit from our parents, that predispose us to the risk of developing the disease. There are individual differences in people's metabolism, especially with increasing age. And there are environmental causes, including types of food available and daily activities. All of these taken together increase the risk of associated diseases, including heart disease, diabetes, high blood pressure, and some forms of cancer, and many other diseases. The disease of obesity kills 400,000 Americans each year, as much as smoking and some forms of cancer. And as a serious disease, the disease of obesity needs to be treated with the best tools that are available, which has been proven to be a combination of surgery, diet, and exercise. On an individual level, let's talk about some numbers that go along with obesity, specifically the body mass index, or BMI. The BMI is based on a combination of a person's weight and height and can be easily calculated by using the BMI calculator link on our website. The BMI number is important because we know that patients with an elevated BMI above 35 or in the range of what we call morbid obesity will go on to experience serious and life-threatening health risks related to their weight over the course of their life. And for that reason, surgery is indicated for those patients whose BMI is above 35. When a patient gains enough weight to reach the BMI level of morbid obesity, over the course of their life, the extra weight that they carry directly damages many of the organ systems and functions in the entire body and causes what we call obesity-related diseases or comorbidities. And it's these obesity-related diseases that include the well-known diseases such as diabetes, heart disease, blood pressure, sleep apnea, and a wide range of joint and back problems, but also does include some less well-known conditions such as acid reflux or heartburn, hormone imbalances, infertility, and even some forms of cancer. Developed over a lifetime, it's all of these obesity-related diseases that will greatly damage a patient's health and ultimately cut short their life. Obesity also leads to a host of other issues in somebody's life, including social issues, hygiene issues, mobility issues, issues at work, and even discrimination and prejudice. But thankfully, many of these issues will improve as patients lose their weight. Now, many of our patients have enjoyed temporary success with medical weight loss over the course of their journey. It's very usual for our patients to have lost 20, 30, or even 50 pounds, but eventually the weight comes back over time. Only 2% of all of our patients who come to us have had success with long-term weight loss for morbid obesity. And for those patients, we're happy and it's a fantastic result. But if the patient is in the 98% group who have lost weight, but then it's come back at some point, they shouldn't feel guilty about that. But it just means that the additional tool of surgery is needed to come alongside the diet and exercise to help better accomplish their long-term success. Surgery, when combined with a new healthy diet and exercise, will help you be more successful with your weight loss journey. It doesn't erase the battles that still need to be fought on a daily basis. Patients still have to eat good things and be active in their everyday life. However, we've seen the great results in our patients who have used the added tool of weight loss surgery to greatly improve their health, which leads to a longer and a richer life.
I would like to provide an overview of weight loss surgery procedures, the gastric bypass and the sleeve gastrectomy. We'll talk a little bit about the two operations and how they compare. We'll go over some of the techniques that we use. We'll even show you the stapler that we're going to use when we do these operations. We'll talk a little bit about the risks and the benefits, and maybe help you make a decision about which operation might be right for you. Whether we're doing gastric bypass surgery or sleeve gastrectomy, we use a laparoscopic approach. This means we put a camera near the belly button so we can see inside, and we use other small incisions to place the instruments that we need to do the work on the inside. When we perform gastric bypass surgery, we use a surgical stapling device to cut across the upper part of the stomach to create a small stomach pouch that's totally separated from the rest of the stomach. In order to get food from this pouch into the intestines where it can be absorbed, we have to create a connection directly to the intestines. We take a part of the upper intestines and connect it with the stomach pouch, and then we create a second connection in the intestines so the digestive enzymes can mix with the food. This creates a Y-shaped connection in the intestine, which is where the Roux-en-Y gastric bypass gets its name. The end result is that a small amount of food fills this golf ball-sized pouch, and it bypasses the rest of the stomach, entering directly into the intestines. The food then mixes with the digestive enzymes at the Y-shaped connection and gets absorbed normally in the rest of the intestines. The intestinal bypass does create a malabsorptive mechanism, so things like vitamin B12, calcium, and iron can be affected. That's why we prescribe supplements for these. But the primary effect of the procedure is the restrictive effect, the creation of the small stomach pouch. When we perform sleeve gastrectomy, we use a similar laparoscopic approach, although sometimes we're able to use fewer incisions than we do with the gastric bypass. Remember that with the gastric bypass, we create the small stomach pouch by cutting across the upper part of the stomach. The food that's in the stomach pouch needs some way to empty into the intestines, and that's why we have to create additional steps of rerouting a part of the intestines. With the sleeve gastrectomy, we use a different approach to reducing the size of the stomach. We actually divide the stomach along its length instead of across. This creates a sleeve or banana-shaped tract leading down to the pouch. It's about the same capacity as a gastric bypass. With a sleeve gastrectomy, a small meal can fill the pouch, and the food empties into the intestines in the usual anatomic way. There are fewer steps involved when performing the sleeve gastrectomy since we don't have to create intestinal connections like we do with the gastric bypass. Using laparoscopic approach definitely has some advantages compared to traditional open surgery. The smaller incisions definitely have less scarring, less visible scarring, but that's not the only benefit. The smaller incisions, I'm sure you can imagine, they're not pain-free, but it's a lot less incisional pain than you have with a big open incision. And because of the smaller scarring and the smaller incisions, usually people are able to bounce back from surgery a bit quicker. They're able to get out of the hospital a little quicker, back to work a little quicker. And so there's definitely some advantages there. The smaller incisions also have less risk of wound healing complications like drainage and infection and problems like that. Even hernias have a much less risk with laparoscopic surgery. When we do laparoscopic surgery for either a gastric bypass or a sleeve gastrectomy, we use staplers just like this when we're doing the operation. And part of the reason why we show you the stapler is because I think a lot of people, when they hear the word stapler, they get a little squeamish. Or maybe they think about their swing line on their desk at work. But a surgical stapler is actually a very precise machine. It's may not be very obvious to people why we use instruments like this when we're doing an operation. One of the reasons why we use surgical staplers like this is because It doesn't take a very big incision at all to get this to go inside so that we can do the work on the inside. Our hands can be out here on the outside manipulating the instrument, but the connections and the seal that's created on the inside between the stomach and the intestines, for example, is created without us having to make a big incision. Another reason why we use staplers like this is because the connections and the seal that we can create is actually a lot more secure and a lot more reliable, reproducible, than if we were sewing it up with a needle and a stitch by hand. So this is why surgical staplers like this are used. It's the fact that instruments like this exist. This is why we're able to accomplish more complex procedures laparoscopically. And I can show you how it works. Basically, it's more easy to show you how it works than it is to try to explain it. But basically, if you consider a model of the stomach, and if we're doing a gastric bypass, remember what we want to do is create a small pouch out of the top of the stomach. If we're doing a sleeve gastrectomy, of course, we're going to make the pouch on here with a little sleeve leading down to it. But say, for example, if we're doing a gastric bypass operation, we can use the stapler to cut across the upper part of the stomach, and the stapling device itself actually produces a cut across the tissue, and at the same time it seals that cut edge to prevent fluids from escaping from the stomach or from the intestines. And you can see that if I use the stapler and I kept proceeding up this way, like this, I would totally separate this part of the stomach from the rest of the stomach, and that's how we produce the gastric pouch. Same thing applies with the sleeve gastrectomy, right? If I start down here, we can create a pouch and cut across the stomach this way. So whether we're doing an operation laparoscopically or open, there's still the same operation steps done on the inside. We're still doing the same procedure. And there still are risks incurred by surgery. Anytime you have an operation, no matter what it is, if we're having to use anesthesia and make incisions, there's risks of problems like infection or bleeding or blood clots or heart problems or pneumonia. You can even have a reaction to the anesthesia or the antibiotics that we use. So any operation, whether it's a gastric bypass or a sleeve or whether you're having your gallbladder removed, any operation is going to have some baseline level of risk. And so in that sense, these operations really aren't any different than most other common abdominal operations. There are risks associated with an operation like this, but if a person is morbidly obese, there are also risks associated with not having surgery. And when you look at it from that perspective, you come to realize what we mean when we say that the benefits of surgery far outweigh the risks when a person is morbidly obese.
Once a patient has met all of the insurance requirements for surgery, they need to have a medical evaluation to make sure the surgery is safe. Since these procedures are done using minimally invasive laparoscopic techniques, it's actually quite rare for us to meet a patient that's too unhealthy to undergo these surgeries safely. Over the years, we've operated on very sick patients, some who are elderly, on oxygen, wheelchair-bound, or even on hemodialysis. However, it's our responsibility as physicians to make sure that any individual medical issues are fully identified and addressed before surgery to make these procedures as safe as possible. This may involve getting clearance for surgery from other medical specialists on a case-by-case basis. In our program, we specifically tailor our preoperative medical evaluation for each individual patient, which may avoid expensive and unnecessary medical tests and evaluations for many of our patients before the actual surgery.
After weight loss surgery, our patients usually spend 1 to 2 nights in the hospital. Most are able to get up and walk around the hospital the same day of surgery. We want you to be active when you get home. We expect you to start at least walking daily from the day after your surgery. The overall recovery time following surgery is 1 to 4 weeks. During that time, most of our patients are able to resume routine daily activities. In fact, many report that they are fairly quickly able to do more than they could before surgery. We have found that the gastric sleeve and the room-wide gastric bypass have similar results in terms of weight loss, with an average of 60% of excess weight reduction. Excess weight is the amount of weight above one's calculated ideal body weight. We do not expect 100% of excess weight to be lost, as this is not healthy. Feel free to visit our website for BMI, ideal body weight, and excess weight calculators. We feel that the real measurement of success is a reduction in obesity-related diseases such as diabetes, high blood pressure, asthma, arthritis, reflux disease, and many more. I want you to imagine a life with fewer medical problems, fewer trips to the doctor, fewer daily medicines, increased energy levels, and more. Studies have shown a resolution of diabetes in approximately 80% of patients and an 82% risk reduction in cardiovascular disease, the leading cause of stroke and heart attack. Gastroesophageal reflux and obstructive sleep apnea resolve in up to 98% of patients. We feel that another important benefit of weight loss surgery is an improvement in mood and self-esteem. We have found in a significant number of our patients that anxiety and depression are greatly reduced. Overall, the risk of death from an obesity-related illness is reduced by 30 to 40% in the first 10 years following bariatric surgery. For all of these reasons and more, one of the best things that bariatric surgery can do for you is bring about a general improvement in quality of life. Examine the ways that weight problems are affecting your life when considering whether surgery is right for you.
A key part of our surgical weight loss program is working closely with you from the beginning to create a lifelong partnership in health. Your first post-operative visit will be about 1 to 2 weeks after surgery. We will follow up with you closely the first year, seeing you in clinic at least 6 times the first year, and then yearly for lifelong follow-up. Each time you come in for a visit, the bariatric team will review your weight loss results, nutritional intake, vitamin regimen, exercise, healthy eating changes, and the status of any health problems you had before surgery. Further education will continue to be provided each and every time. Close follow-up will allow us to ensure that you are losing weight in a healthy manner, that you're getting the proper supplementation, and help us identify or prevent any post-operative complications. Research shows that patients who maintain regular bariatric follow-up visits will have greater long-term success. We conduct lab work every few months the first year, and then at least yearly to check the status of vitamin and nutritional levels. We also encourage you to maintain a close relationship with your primary care provider and other specialists. They will need to continue to monitor your general health or any health problems you had before surgery. We share all office notes and labs with your providers to make sure the lines of communication stay open. We look forward to partnering with you as part of your healthcare team. We thank you for your interest in our program and are proud of all we have to offer. I hope to see you soon to discuss how we can best meet your needs.